Hi, my name is Kate Oldham. I'm a lymphedema patient, but also a lymphedema practitioner. I've worked with national and local charities and specialise in breast cancer care. I'm lucky to live in an area where we are fully supported by the NHS with a lymphedema clinic. But in my experience with patients around the country, this is often not the case. I only have checkups if I feel anything has changed. I measure myself every 3 months to check for changes and monitor my skin. But my main interactions are usually because something has bitten me. My compression garment saves my skin so many times, but sometimes the bugs are a bit more determined. I can communicate by email and my clinic responds really quickly if action is required. I feel really well supported by this clinic, and again, I know I'm lucky. Being a lymphedema practitioner as well as a patient, I am probably biased. But I think the lymphatic system is the unsung hero of our body and will bore anybody who listens to how great it is. I feel we need to boost the awareness of lymphedema, how it affects people, and how important it is to look after our well-being through looking after our lymphatic system. A cancer diagnosis and subsequent surgery and treatment would have been enough to deal with, without having a full auxiliary clearance. I feel that if I hadn't known about the lymphatic system and if I hadn't have been lucky enough to be looked after so well, it would have been a very different outcome with regards to my care and my knowledge of lymphedema risks. Other patients aren't so lucky. If we could improve the way risks are talked about in the NHS and how important the lymphatic system is, then that would be at least a step forward. We have, however, fantastic support outside of the NHS through the British Lymphology Society, the Lymphedema Support Network, and other great support groups who provide easy-to-access research-based information for patients. Lymphedema doesn't need to be a chore. Find ways of looking after your lymphedema that suit you and your lifestyle. Even as a practitioner, I don't do everything that you should do every day. I listen to my body and I react to what it needs. This takes time, but it is so worth it. The lymphatic system is amazing. It's an integral part of our overall health and well-being, so it's well worth treating well.